Welcome to Kids Considered, where two pediatricians discuss children's health topics of interest to parents in a podcast with new subjects considered every episode. I'm Dr. Lena Vanderlist.
And I'm Dr. Dean Blumberg.
And we're both pediatricians at UC Davis Children's Hospital in Sacramento, California. For today's podcast, I am thrilled to be joined by a co-host, Dr. Kelli Derrah. Dr. Kelli is a pediatric resident here at UC Davis and really an expert on this topic of hospitalization because really no one spends more time in the hospital than medical residents.
Thank you, Dr. Lena. Very sad, but very true. On today's episode, we are going to talk about something that no parent likes to think about. So having to take your child to the hospital. Sometimes, since we are in the hospital so often for our jobs, we forget that going to the hospital is actually a major life event for our families.
Totally. It's such a big deal. And unfortunately, it's not that uncommon. I think I've shared with our listeners in the past that my daughter Mira got admitted with bronchiolitis, which is a viral lower respiratory infection, and was admitted for 4 days when she was 15 months old. And it was really a horrible, traumatic experience for all of us involved.
So, Dr. Lena, how would you recommend that families best prepare for something like that, like having their child admitted to the hospital?
Yeah, so preparing your kid for something, right, is much easier when it's a hospitalization would be planned and much harder when it's unplanned, like racing your kid to the emergency room in the middle of the night. So when you have something planned, a procedure planned, so that might be going in, like, let's say your kid gets a ton of ear infections and they're going to get ear tubes, which we've talked about before. Then there are tons of like great books or social stories or Daniel Tiger episodes that can help prepare your child. Those types of hospitalizations may be called planned or direct admissions. Unplanned hospitalizations are those things like middle of the night visits to the emergency room for breathing issues or your kid falls down and gets a cut. And those are harder to plan for. But as you're in transit, it can be helpful to have a parent kind of talk them through what to expect.
Kids actually make up a pretty big portion of all emergency department visits. So more than 1 out of every 7 emergency department patients is actually under 16 years old. In these situations, the emergency department staff will evaluate them, treat them, and then either determine, like, A, they're ready to go home and are well enough to be cared for at home, or B, they are sick enough that they need to be admitted to the hospital for further treatment.
Yeah, so a lot of families, like in my clinic, will ask, which emergency room should I go to? Like, should I drive further to like the big fancy hospital? Should I go to our community hospital? What do you think about that?
In a serious emergency, you should always just go to the closest ER. That one's kind of straightforward. In some situations, you should actually call 911 to get an ambulance instead of taking your child to the ER yourself. Call 911 for things like if your child has trouble breathing, is turning blue, if you guys were in a car accident and someone is unconscious or seriously injured, if your child is having a seizure, loses consciousness, so that would be like passing out or is not responsive.
Absolutely. Those are all emergencies, and you need 911 because the emergency personnel can help monitor your child en route to the hospital. It's super important. But for all of us parents, we should really look up where our closest emergency room is and have it on hand in case you opt to drive. So in those cases where like your kid's riding their scooter and they fall down and they get a great cut on their chin and you're like, uh-oh, that's probably going to need stitches, you want to know where to go. And some people may consider driving to an emergency room that's connected to a pediatric children's hospital. So most of you know that Dr. Dean and I and Dr. Kelli work at UC Davis Children's Hospital. So we have a specific pediatric emergency room that's staffed by pediatric trained physicians. And we also have a lot of pediatric consultants, so pediatric surgeons and cardiologists and all of that. So if your kid has something going on that needs that specialist care, that can be helpful, because if you go to a community hospital, which are amazing and have amazing staff as well, but might need something like a pediatric surgeon, then you're going to be transferred to a specific children's hospital that has those people. And while that can go seamlessly and smoothly, and if it needs to happen, it's better that your kid got to that place first and got stabilized before they were transferred. It can be one extra added like stressful piece of this puzzle for families and parents.
Okay, So let's say you take your child to the emergency department. There's some things that are going to be important to know that are going to make things run a little bit more smoothly once you're there. So knowing the details of your child's current problem, including when the problem began, so that would be like the time of injury or how long your child has been sick, the symptoms of the current illness or injury, any treatments or medicines that you've already tried at home, when your child has last had anything to eat or drink, especially if there's a potential that they might need surgery. It's also important to know what medicines your child takes and what doses. So bringing the actual pill bottles or the medicine bottles is helpful so you can accurately tell the medical team what medicines and what doses they're taking. Once you share all of this information with the team, they will evaluate your child and they may determine that they must be hospitalized.
Yeah. So that means you're not going home and you're staying overnight. And so what are the most common reasons that kids are admitted to the hospital?
Yeah, so actually the top 5 reasons for a child to be hospitalized after going through the ED are asthma, pneumonia, lower respiratory tract infections, so that's like bronchiolitis, appendicitis, and fluid and electrolyte disorders such as dehydration. And then based on how sick with any of these illness or other illnesses, that'll kind of dictate whether they need to go to the pediatric ICU or just a regular hospital floor.
Yeah. So just for listeners, the intensive care unit or ICU is like for the sickest kids, of course. That's what you think about, like it being your kid being really sick. But sometimes it's even just for like nursing ratios. So for kids that need like direct one-on-one care, or like they need their heart rate monitored consistently, then sometimes they have to go up there because on the floor, you might be sharing your nurse with 3 or 4 other patients. And usually in the ICU, it's one-on-one. So that determines that. And sometimes people go up to the ICU only for like a few hours and then they realize, oh, the kid's really okay. And they move you down and out. So unfortunately, you kind of have to be very flexible when you're admitted to the hospital. But once a family gets admitted, what should they expect a typical day in the hospital to look like?
Morning, unfortunately, generally starts quite early. So various team members will be checking on the patient or the child. This can include nurses, doctors, residents, and then additional trainees such as medical students if you're admitted to a teaching hospital. And one question that comes up a lot is what actually is a resident? So a resident is someone who's completed medical school but is still in training. So you do residency in a specific specialty. So you may see a pediatric resident, or if your child's there for a surgical reason, they may see a surgery resident.
Right. There are lots and lots of team members. And so it's always important to, ask and clarify who it is. Luckily, a lot of places will have like little badges. Like we have these like little on our medical badge, it'll say like doctor or nurse or something like that can be helpful too. Later in the morning, rounds will occur. And so if you're a big Grey's Anatomy fan or any other medical dramas, I don't watch them because it's too real for me. Like I want to get away from that stuff. But you may be familiar with what rounds are. And that's when your entire team is going to meet with you, examine your child, and talk about the plan for the day. So the plan for the day may be ordering new blood work or new imaging. So like, let's say your kid's there for pneumonia, maybe they'll get a repeat chest x-ray to see how it's doing. They might be prescribing new medications or talking with other specialist doctors. So if your kid's admitted for an infection, maybe Dr. Dean will come by and see how they're doing since he's an infectious disease specialist.
And with all the team members in front of you, rounds can definitely be a little bit overwhelming. One tip that I would give to families would be to make sure to write down all of your questions ahead of time. So you can use even your phone, a piece of paper, or they're generally whiteboards in the room to jot down questions that kind of come up throughout the day. And then that way you remember them for when the whole team is there.
Yeah, totally. It's an overwhelming experience. And so it can be common to forget those questions with so many people around. So having something written down is extremely helpful.
And just to piggyback off of that, it is perfectly okay to ask questions. Advocating for your child by asking why certain things are being done or why certain things aren't being done is absolutely important and expected. Also, feel free to ask for clarification about who different team members of your care team are when they come into the room, because there will be a lot.
Yeah. And I remember that, like being like, are you the respiratory therapist? Are you our nurse? Are you the medical student? Who are you? So yeah, totally feel free to ask questions. Throughout the day, doctors or nurses are going to come back in and repeat exams or check on your child. But the main point of contact is going to be your nurse. So I think every person I've talked to, whether it's from their child being hospitalized or, their delivery experience, they remember their nurse because they're really amazing. And they're the ones that are bringing your kid snacks and water and toys and like just checking in with you guys. And so they're really amazing. Get to know your nurse. And most of them, I know ours are wonderful. Most children's hospitals will have a playroom on the pediatric floor, which is amazing. Wintertime, maybe it doesn't get as much use because all of the kids are contagious and we don't want them spreading germs. But if your child is feeling well and not contagious, then they definitely should spend time in the playroom if there is one.
And there's many more people besides just the doctors and the nurses in the hospital who you may come across, including different administrative staff, medical assistants or technicians, social workers, and child life specialists.
Yeah, so let's take a second to talk about the role of child life specialists. We did an episode on this, but it was a long time ago now. We actually had one of our amazing child life specialists on to talk about grief and bereavement. I have to see if that episode is still available. And if not, we should repost it because it was amazing. But a lot of families are not aware of this role or this profession. So can you tell us what child life specialists do?
Yeah, it's one of the special things about a children's hospital. So in children's hospital, they typically have a child life team, which is made up of different people called child life specialists who are highly trained in child development. They play a crucial role in helping children and their families navigate the different challenges that come with a hospitalization or an illness, especially the medical procedures. So one of the procedures that your child may have would be like a lab draw. So they can help with that. They can also help with the process of placing an IV and if imaging or surgeries are needed. So what they do is they help prepare you and your child for this new experience, and they can use different kind of tools like stuffed animals or toys to help explain why it is happening and what is going to be happening and explain it at the correct level for your child to understand.
Totally. I love like going into the room and seeing like the little kid that has like the teddy bear with the IV in the same exact spot that their IV is, or like they have a little MRI machine. I don't know if any of you have gotten an MRI before, but it's like extremely loud and scary. And if you're claustrophobic, it's not ideal. But they have like little practice ones or miniature ones that they can show kids. They do breathing exercises with them, counting. They use distractions such as bubbles, lights, different sounds, movies. We even have people, I think, that do Reiki, which is like a type of massage and calming technique in the hospital. So all of these things can be tools to help support your child during a difficult procedure.
So can you talk a little bit more about what it means to have an IV and why it's sometimes needed?
Yeah. So IV stands for intravenous or into the vein. So to place an IV, they're going to put a tiny needle to find your child's vein. And then there's like a small plastic catheter, which is like a little straw that advances and goes just under your child's skin. And the needle is taken out. An IV is sometimes necessary to give certain medications like antibiotics or stronger medications or something that's like maybe more frequently than your child would be able to take by mouth. Also, they're commonly used to give fluids if your kid's not drinking well or if they're having vomiting and diarrhea, seeing a lot of that recently and not able to maintain their hydration by mouth. Then they would need an IV until they're able to drink enough to maintain their hydration.
And we also talked about labs. So this refers to drawing blood. Sometimes that can be collected from the IV if a child has one. And sometimes it unfortunately requires a separate blood draw. So that can be scary, but there are a couple of things that we do in a children's hospital to make it less traumatic of an experience for children and their parents. One of those things is trying to group the blood draws together so that we aren't needing to poke a child multiple times throughout the day in order to get the information that we need. Occasionally it's impossible to do because of the specific labs that are needed, but we do our best.
And apart from labs and other procedures the teams may discuss with you during rounds, another main piece of data that we use as doctors and nurses use is your kids' vital signs. So what vital signs are your kids' temperature, their heart rate, their blood pressure, their oxygen level, and their breathing rate. And so this may be monitored by like a few stickers that they have on their chest or a little sticker that measures that oxygen and heart rate on their finger or their toe. I have to be completely honest, this is the most annoying thing of being a parent in the hospital because these machines are constantly beeping, whether your kid has an abnormal value. So usually there will be like if the heart rate goes above 140, then it's going to alarm. But they also alarm like when the stickers fall off, which when you have a, 16-month-old or however old Mira was, that's happening all the time because they're in constant motion and they're ripping things off.
Mm-hmm.
So they're beeping, but nurses are great about checking in with you and helping you silence these machines or adjust things. And they are super, super helpful tools in telling your doctors how your kid's doing and if they're improving or they're worsening. So even though they're annoying, they're really critical to your child's hospital admission.
And speaking of oxygen, sometimes your child may need help with the oxygen support if they have a respiratory illness, such as like an infection or an asthma exacerbation. Respiratory therapists are another member of the team that generally make adjustments to the respiratory support or interventions. There are many different respiratory interventions that you may have or that your child may have, including nasal cannula, high flow nasal cannula, and nebulizer treatments. So nasal cannula just delivered oxygen right through the nostrils. But if your child is needing more support above that, they may need to switch to a special kind of nasal cannula, the high flow nasal cannula, that can safely deliver a larger amount of pressure or flow through the nose. Nebulizers are something that turn liquid medicine into a mist so that kids can breathe it in and are often used as an alternative to inhalers, especially for asthma exacerbations in young children who aren't able to tolerate an inhaler or don't want to cooperate with inhalers.
These are great points. Of course, for kids that are even more sick, then there can be things like being intubated, right? Which means that there's like a breathing tube to assist them. Those kids would need to be in the pediatric ICU. There's lots of other respiratory supports, which are kind of beyond the scope of our discussion today, but commonly used because we talked about respiratory illnesses being some of the most common reasons kids go to the hospital. And also very annoying to have a 1.5-year-old who's constantly pulling out her high flow nasal cannula and having snot everywhere. And they tape it onto their face to help it stay in place. And I swear she had these little patches of like eczema on her cheeks from that for like a full year. It was pretty hilarious. I know, poor thing. If your child's staying overnight, which most do, if they're admitted to the hospital at least one night, there's going to be like a little pull-out chair bed that is the most uncomfortable night's sleep you're ever going to have so that you can stay with them. As far as meals go, the hospital will provide meals for your child, definitely for the parent if they're breastfeeding. But if they're not, the parents are usually expected to provide their own meals. If financial strain is something that is present for your family, then there are usually social workers that are present that can help get vouchers for the hospital cafeteria or other places to assist you.
So wrapping up, what can you expect when your child is ready to leave the hospital or be discharged, as we commonly refer to it as?
Yes, everybody wants to know when it's time to leave. So depending on the reason your kid is admitted, there are different milestones that your team is looking for to help them determine when your child's ready to go home. They don't want you guys coming back right away, right? Or they don't want to do anything that's unsafe. So for example, if your child's admitted for bronchiolitis or lower respiratory tract infection, your child will want to see that they're breathing comfortably so they're not having those significant retractions and that they've been off any oxygen support for at least 8 hours. If your kid was admitted for dehydration, they want to see that they're able to drink enough fluids to keep them hydrated, so at least have 1 pee every 8 hours or so, and that they haven't needed an IV for maybe 6 to 12 hours and are able to do it all on their own like they would at home.
They also want to make sure that the family and the parents are able to do the care that the hospital is doing at home too. So in asthma, we want to make sure that the families are able to give the appropriate amount of medicine at home. So we make sure that the child is able to safely go about 4 hours between either nebulizer or inhaler treatments in order to make sure that they're ready to go home and that the cares can reasonably be done at home. And of course, if the child is on any IV medication, they need to complete that prior to heading out of the hospital.
Right. So let's say you've met all of these milestones, you're ready to go home, your team has rounded in the morning and said you're going home. Don't get too excited yet. Don't go and, start the car because things in the hospital take a very long time. It's going to be probably a couple hours, if not, up to 6 hours for your child to be ready to go home. So your team needs to put in orders. They need to send any medications that your child may need to the pharmacy, and you will need to pick them up and have them in hand. Your nurses or your other teams will need to go over what signs or symptoms you should bring your child back to the hospital for and make sure that you're aware of the care plan. If they have any follow-up with specialists, so let's see your child needs to see infectious disease or neurology in a month, then they like to have those appointments set up. And they should also help set up an appointment with your general pediatrician a few days after leaving the hospital. And then you can walk out the door.
It really does take a while.
But it is very liberating when you do get to walk out those doors and that first night back in your own bed. Or I think I was sleeping on like an air mattress next to Mira's crib for a few days just to make sure everything was okay.
Anything's better than the cot.
Yes, anything is better than the cot. Exactly.
Great. Well, that pretty much covers it. From coming into the hospital and being admitted all the way to being discharged and heading out of the hospital and making it to your home.
We hope that you never have to take your child to the hospital, but in case you do, we hope that this information helped remove some of the mystery and helped prepare you for what to expect.
Yep, that wraps up this episode of Kids Considered. Let's summarize the main points.
So ER visits and hospitalizations are pretty common in children, but they are definitely overwhelming for kids and parents alike.
In this episode, we reviewed what to expect from the common schedules to procedures and team members.
We also discussed strategies for making the experience less scary and painful for your child.
And finally, we reviewed criteria that may indicate a child is nearing the time to go home. So, Dr. Lena, I'm curious to hear your perspective on being both a parent and a pediatrician who was admitted to the hospital with your child recently.
Yeah. So like I said, it was a year ago now. So it's all getting a little faint and blurry, like all trauma experiences do. But Mira, my daughter, she tends to get pretty sick with respiratory illnesses. And this specific time I noticed I was actually breastfeeding her. And I just noticed she was breathing so fast and breathing so labored. And I took a video and I sent it to all my residency friends. So in medicine, we typically have our little tribe of people that you consult your own medical decisions on. And they were like, yes, take her in right now. And so we went to the ER. I thankfully, I had all of my people there, people that I had done training with and currently work with. And they put her on that high flow oxygen, which you talked about, or it's more like pressure that helps blow past all this mucus that's impairing their breathing and allows their airways to open up a little bit. But it's kind of uncomfortable for them, right? So she was constantly trying to pull it off and she wasn't sleeping well and she had a fever. And so I would say that while I felt so safe and we supported there and our nurses were amazing and everything, the biggest thing for me as a parent was just realizing oh, wow, this is a scary experience. And also, I just felt more protective than I expected to be. So I consider myself a very chill parent. We went to the dentist this morning and I held her down while she screamed so they can look in, I'm not the type of parent that's oh no, that, don't touch my child. But when your kid's going through something like that and you do have the third doctor come in to examine them or they just fall asleep and they haven't slept all night and then a medical student comes in to look in the ears, I found myself saying oh no, can you come back later? All of the things that I would roll my eyes at when I was on the other end, I was doing. And so I think the biggest takeaway for me was, oh my gosh, this is a stressful experience. It must be so much more stressful for someone who has never lived this or been through this every day. So if I'm stressed out, I can't even imagine what a parent that just walked in with no medical expertise and just that really all you want is your kid to get rest, get better. And the hospital is just kind of a sucky place to be. And you're all exhausted. You're all wanting to go home. And so I think that it's important for us as physicians to keep that perspective in mind.
That wraps up this episode of Kids Considered.
You can find more information on our website, kidsconsidered.ucdavis.edu,
Follow us on Twitter at Kids Considered.
and Instagram at Kids Considered.
If you have feedback on this show or topics you would like us to discuss in the future, we would love to hear from you.
Please call us. Our number is 916-915-3388.
Or email us at kidsconsidered@gmail.com.
Please rate us on iTunes or wherever you subscribe to your podcasts.
Thank you for listening, and we hope you will join us for our next podcast.
Kids Considered is sponsored by UC Davis Children's Hospital.